Welcome, everyone. I am absolutely thrilled to have you here for this explainer. Today, we are setting off on a truly mind-bending journey into modern medicine. We're looking at a field of science that is moving so incredibly fast right now, it's quite literally rewriting the textbooks on human biology. If you're the kind of person who loves seeing how complex scientific barriers are broken down piece by piece, well, you are in exactly the right place.
So let's start with a massive question. Is hearing loss permanently irreversible? For most of modern medical history, the answer has been a very heavy, definitive yes. There's this widespread assumption that once you lose your hearing, whether that's from age, noise exposure, or genetics, it's just an inevitable, permanent fate. But what if I told you that the scientific community is right now proving that assumption completely wrong?
Section 1. Medical baselines. Conductive versus sensory neural. Okay, let's dive into this because to really get how we're reversing hearing loss, we first have to understand the biological realities of how we lose it in the first place. So there's a pretty stark contrast between the two main types of hearing loss. First up, we have conductive hearing loss. Think of this as basically a mechanical issue, right? It's a physical blockage like impacted earwax, fluid from an infection, or maybe bone growth in the middle ear. Because the inner ear itself is totally fine, this type is actually often fully reversible once you just remove the blockage. But then we have sensory neural hearing loss, and this is the big one. We are born with about 15,000 tiny sensory hair cells in each inner ear. Once those are damaged by decades of aging or blasting loud music, they don't regenerate. So I want to be perfectly clear right up front to avoid any false hope. If you have everyday age-related or noise-related hearing loss, it currently remains incurable. Hearing aids and cochlear implants are the standard of care, but we just can't grow those specific cells quite yet. Now, there is one critical, super time-sensitive exception to that rule: sudden sensory neural hearing loss, or SSHL. If you wake up one morning and suddenly can't hear out of one ear, that is a medical urgency. The science shows that if you're treated with corticosteroids within a very narrow 2 to 4 week window, there's a genuine chance of reversing or reducing that permanent damage. It's a vital medical baseline to know. But right now, I want to pivot our focus entirely away from age and noise and look squarely at genetic sensory neural deafness. Which brings us to Section 2, the climax, the OTOF gene breakthrough. We are looking at the miraculous medical advancements making global headlines recently, specifically regarding congenital deafness, meaning children who are born completely deaf. Let's break down the exact biological problem we're solving here. Some children are born completely deaf because of a mutation in a specific gene called OTOF. This gene is basically the blueprint for producing a protein called otoferlin. Otoferlin's job? It takes the sound vibrations hitting the inner ear and translates them into electrical signals that the brain can actually understand. So if you have an OTOF mutation, you completely lack this protein. The ear parts might vibrate perfectly fine, but the brain receives absolute silence. 90%. Just let that number sink in for a second. In the largest clinical trials to date for OTOF gene therapy, 90% of participants successfully recovered functional hearing. We aren't just talking about a slight clinical bump on a chart here. We're talking about a paradigm-shifting reversal of a condition that was previously thought to be an absolute, permanent life sentence. But the absolutely crucial point is understanding what that success actually feels like for a real patient. Trial participants went from an average of 106 decibels, which is profound isolating deafness, down to 52 decibels. We really have to treat this data as emotion. Dropping to 52 decibels is literally the difference between profound silence and hearing a mother's voice for the first time. In one trial reported by the Karolinska Institute, a 7-year-old girl recovered almost all of her hearing and was able to hold normal daily conversations just 4 months after treatment. So how does this actually happen? Well, it's done through a single injection into the inner ear. Think of the treatment like a microscopic delivery truck. Scientists use a synthetic virus, an adeno-associated virus, or AAV, which has been completely hollowed out of any disease. This AAV delivery truck drives right into the cells of the inner ear and drops off a healthy, fully functioning instruction manual for the OTOF gene. By month 1, the cells start reading the manual and producing otoferlin. The brain starts receiving signals, and by 4 to 6 months, we see children developing actual conversational ability. The speed of this is just breathtaking. Okay, with results like that, regulatory agencies absolutely had to pay attention. This brings us to Section 3, the milestone, first FDA gene therapy. And this brilliantly illustrates just how fast the needle is moving right now. The FDA just granted accelerated approval to Regeneron's groundbreaking therapy, Otarmeni. This marks the very first time the FDA has ever approved a gene therapy for genetic hearing loss. It opens up an entirely new frontier, way beyond traditional mechanical fixes like cochlear implants, fundamentally altering the standard of care for these genetic cases forever.
And the data backing this up is incredibly robust. In a massive clinical trial conducted by Fudan University alongside other global hospitals, researchers followed 42 patients, ranging from infants as young as 9 months old all the way to adults over 32. Across the board, this single inner ear injection was well tolerated, with absolutely no serious side effects or dose-limiting toxicities. What's even more fascinating is that the pediatric patients, specifically those between 6 months and 3 years old, responded exceptionally well. It just proves that early intervention is the absolute key to unlocking language and cognitive development. Now, we've solved the puzzle for the OTOF mutation, but it only accounts for a fraction of genetic deafness. Let's widen the narrative funnel a bit and look at Section 4, the horizon, CRISPR tools, and the future. Because here is the biological roadblock we face next. Remember our AAV delivery truck metaphor? Well, these viral trucks are amazing, but they have a very strict cargo limit of about 4.7 kilobases of genetic code. Now, the OTOF gene, it fits perfectly. But contrast that with the USH2A gene. Mutations in this gene cause Usher syndrome, which is a devastating condition leading to both deafness and progressive blindness. The USH2A gene is a massive 15.7 kilobases. You simply cannot fit that instruction manual into the delivery truck. And trying to use multiple trucks to deliver the gene in tiny pieces has proven to be, well, highly inefficient.
So, what do? How do we fix a gene that's just too big to replace? Well, we don't replace it. We edit it. Instead of gene replacement, where we try to deliver the whole massive gene, we use next-generation CRISPR base editing. Instead of a giant instruction manual, we load the delivery truck with microscopic proofreaders. These CRISPR tools have been shrunk down so small that they fit perfectly into the AAV truck. They travel into the inner ear, find that massive USH2A gene, and literally swap out a single defective letter of DNA for a healthy one, changing an A to a G without ever cutting the DNA backbone. We don't need to replace the whole 15.7 kilobase gene at all. We just go in and fix the single typo that's causing the disease.
From mechanical blockages all the way down to single-letter genetic typos, our understanding of human hearing has leaped from just managing symptoms to actual functional reversal. We are literally watching the word permanent be erased from medical textbooks in real time. So, I'll leave you with this final thought. As our microscopic delivery trucks get more efficient and our gene editing tools shrink down to correct a single letter of DNA, which permanent condition will we reverse next? Thank you so much